as well. And then we've got mobile apps specifically to perinatal monitoring and other monitoring type systems that would fall within the oversight of the regulations. However, there is this notion of enforcement discretion. And the FDA has been very specific that it does not intend to enforce the requirements under the FDA Food, Drug, and Cosmetic Act to all mobile apps. There are very specifically some kinds of mobile apps that, while they may be interacting with patients and may be related to medical data, that by virtue of the intended use and the risk, and Anura spoke very specifically to certain types of risk profiles that could occur for mobile medical apps, the FDA then would not enforce the requirements of the Federal Drug and Cosmetic Act while using this enforcement discretion. So, for example, patients' self-management. It could include access to information related to the patient's health conditions or applications intended to communicate to their healthcare providers. Again, the guidance provides a lot of information very specifically about these types of applications, and we always go back to the product's intended use. An important element, and I'll repeat it, to look through all of the labeling for your product and to be assured of your communication of intended use through the labeling and labeling claims. Anura, could we move forward? I'll give you a couple of examples of mobile apps that are not regulated by the FDA and those that the FDA would not apply the oversight. And that would be, specific generic text search capabilities. So, for example, as a nurse or physician, if I'm looking up information, that might be a mobile app that is not regulated as long as its intended use falls within that very narrow definition. That would include mobile apps intended as education tools or medical training tools, or possibly even tools to reinforce training for clinicians. Other types of devices that are intended for patient education, very specific, patient awareness and empowerment for their own health and wellness, and other types of applications that provide efficiency within a clinician's healthcare setting, not intended for, again, diagnosis of disease or other conditions for the cure, mitigation, or treatment of patient disease. The last, we've seen a number of applications too that again fall outside of the scope, things like magnifying glasses or recording devices or maps and things of this nature, general information type systems that fall outside the scope of a mobile medical application. So we have an interesting